I woke up and I was in no pain. I came home, I was in no pain. I had to talk more about that. So let's just say that was the day. Okay, yeah, I was gonna say, because there's a lot more to that.
I had my mastectomy 4 months ago, and I had my reconstruction surgery 2.5, 3 weeks ago. I know, I really am, the poster child for bouncing back, and I completely credit, the block and the kind of care I got at GW.
You go in having a mammogram as something on your to-do list, and then my to-do list changed immediately after that. When I was first diagnosed, everybody has their thing that they do that calms them down, that they think. Some people cook, some people take a shower, some people take a walk. I vacuum. I did it before the surgery and I did it after the surgery. That's what I do. I vacuum. It calmed me down. So anyways, I don't have long blonde hair. I don't have long lanky legs. I had great boobs. So for me to let them go as quickly as I did, I wanted them off so I would never have to think about this again. But my main focus, besides getting through the surgery, was my kids. I wanted to be fixed and move on.
You're not only thinking about, what are the next steps in your medical care, but, you look at your family and it just, all of a sudden, it almost like freezes and you're sort of caught in this moment. I just never expected that this was going to come back positive. There was peace of mind that decision was out of the way.
One of the things that I find really rewarding is to be able to provide many options for pain control after breast cancer surgery. It can be overwhelming to hear all of these options, and at a certain point I think some women just say, I don't want to make any other decisions. It's a hard topic to conceptualize and to talk to patients about.
There's definitely an assumption that they will have to deal with pain. And then as they transition to go home, they'll take some medicines by mouth that are painkillers. We'd like to think if we have the opportunity to share with patients the multimodal approach using several different types of medication that get at pain from different angles, then we can provide a more holistic approach to the control of pain postoperatively.
The next anxiety and stress I had was the recovery. I'm a relatively strong person, but that to me was very frightening, that whole process. I wanted to get as much information as I could about what would happen to me and my body after that surgery.
I anticipated post-surgically that I would be in a lot of pain. I assumed when I got home, I'd be lying in bed, begging my husband to bring me more pain pills. Instead, my doctor said to me, you really should think about this pain modality called the paravertebral block.
To get you through that first really uncomfortable period of time, paravertebral nerve blocks are something that the patient can actually go home with.
This is really targeted pain relief, very similar to an epidural, but instead of going in the midline of the back, it's just off to the side of the backbone.
For most women, really does minimize the amount of other medications that they need to take.
I didn't want the 6 to 8 weeks of recovery to really be characterized by pain and sadness and stress. I decided to have that nerve block And as a result of that, my recovery was much quicker, not weighed down by pain.
When we place the paravertebral nerve block, we place a small flexible catheter that stays in place for the whole time that you have the nerve block. It sits under your skin that releases medication on a continuous basis. It's attached to a ball of medication that releases the numbing medicine at a rate that we set.
Slowly those infuse, you don't have to do anything with them, and when they become flat, they're empty.
We'll just have you peel off the dressing that keeps the small catheter in place. You'll remove it and throw everything out at home.
And that's when my husband just took the tape off and threw the entire fanny pack, wires, everything went into the garbage.
You'll have a bag that can hold the medication that can go around your waist or around your neck.
Well, when they told me that I was going to be coming home from the hospital with this nerve block, I did have this image of IV pole and being saddled in a chair with this huge machinery. I was quite amazed. I mean, they brought me this fanny pack that almost looked like I was going on a hike.
I entered back into life and back into being a mother 5 minutes after I woke up. Just to be able to see my kids when they walk through that door and see me standing there with a smile, their face changed. I think that was the first time my kids exhaled.
I want my life back, and the team at GW and the option for the nerve block gave me that option. I was able to sort of resume my life, see my family and friends, and be back to the old Jackie, and that was a gift for me.
Paravertebral nerve blocks or the thoracic epidural is one more procedure that the woman will have before she goes back to the operating room. Some women absolutely say, I want to do everything possible not to take a pain pill, and some women say, I don't want to have another injection. On the day of surgery, it really is the patient's choice in terms of how she wants to manage her care.